Hello and welcome everyone to a Keystone Contractor Association webinar. With May being Mental Health Awareness Month, we wanted to provide some excellent and informational webinars that we think will be beneficial to construction professionals. And I'd like to give credit where credit is due. Our speaker for the series, kicking it off, is Kara McCaffrey from Houck. And a couple months ago, Kara said, I have a good idea for a webinar topic. It's more of a general, just kind of talk about mental health and get it within the industry. But Kara approached me and said, what if we create a whole series for the whole month of May, because it is Mental Health Awareness Month. And I thought that was an excellent idea and excited for the lineup that we created for May. So like I said, this is the kickoff event here. This is Let's Talk About Mental Health. And also included in this series is next Monday, May 13th at noon. We have Sebastian from Skill Signal, who's on the webinar today. He's going to present a topic called Construction Wellbeing Initiative. And then May 20th, Naloxone 101, presented by Chris Lalevee from the Operating Engineers 825. Chris is really on the forefront of pushing Narcan on every construction job site in America, so we're excited to have him. And then to close out the month, we're having a presentation called Living, Working, and Fixing Anxiety and Depression from a Construction Executive. This individual, Chris Linton, works out of the southeastern Pennsylvania area. And he approached me about a month ago and said that he's had some real struggles in his life, and he feels as if sharing his story can help others. And we are just thrilled to include him in this all-star lineup. But yeah, just to kick things off, I think everyone's really going to enjoy today. I know I'm really excited. This is going to be awesome. Kara's really passionate about this area, mental health and suicide prevention, and she does a great job in this area and really opening the lines of communication and get people talking about it, and get people thinking and helping people. So without further ado, I will shut my mouth and give it to Kara and let her take it away. I know she has a process for questions, so I'll let her explain that. But like I said, yeah, we're excited, so can't wait to hear the presentation. Thanks, Kara.
Thanks, John. Thank you so much. Hi, everyone. My name is Kara McCaffrey, and I am beyond excited to join in the beginning of KCA's webinar series for Mental Health Awareness Month. Thank you all so much for attending and making the time to be here today. And thank you so much to KCA for hosting. I got the attendee list before, and we have a wide array of people attending from different kinds of construction trades, also different universities. So we have a wide group of people attending, and I hope that you can take something away today. So we're here to talk about mental health, which can sometimes be hard, right? But I really think the more we talk about it, the more we make it okay to ask for help, and the more we break down the stigma. So I'm thrilled to talk about mental health with all of you today. And for those of you who know me, I could talk about mental health for hours. We have 1 hour to talk about it today to start the conversation. A little bit about me. So, before we get started, kind of my background and why I care about this and how I came into this. Well, first of all, there's my family. Some of you may know them. Dean and Miles are my two kiddos, and Kyle, my husband. They're so important to me. But work-wise, professionally, to share a little bit more about me, here is a little bit of my bio. I am part owner and chief wellness officer at my family's specialty construction company at Houck. And I worked in construction for about 4 years until I moved away. Actually, I stepped outside of construction and spent time in healthcare IT. Over a decade, I spent working for Epic, which is a medical software company. Maybe many of your clinical medical records are part of that software. But while I was there, I led their suicide prevention team, and I also drove mental health initiatives at the company of over 13,000 employees. I had the opportunity to learn about mental health and suicide from a clinical perspective. So I got to learn from different clinicians and researchers from across the country while we worked together to put tools into the software system to better identify patients at risk, better treat them, and better follow up with them. That was a great experience for me, and I took all of that lessons learned from the clinical side before recently rejoining my family company. I'm also a mental health first aider. I'm a certified vital cog trainer. I can explain what that is later. And I'm a member of several different regional and national committees that focus on this important work. One being the Keystone Contractors Association Mental Health Task Force. I'm honored to be a part of that group. If you can't already tell, I care a lot about mental health. It is something that I am passionate about both personally and professionally. And I've lost people in my life to suicide, which is a big part to why I care about this. But this is a little bit about who I am. As we get into the talk today, just wanted to quickly mention that if you need to step away at any point to take care of yourself, to take a breather, please do so. I want to make sure that you're taking care of yourself, and this topic can hit close to home for some folks, and it can be uncomfortable at times to talk about. So please take care of yourself, but I appreciate you being here today with us. We will have Q&A. We should have some time at the end of the hour talk that we have, but feel free to put questions into the chat feature. It should be in your Zoom option to just put in the chat to everyone or to me individually if you'd like to. And I will answer those as questions come up if they fit in. And at the end, we'll have time for questions as well. So feel free to chime in throughout the chat as we go along. And remember that if you need to step away from the computer at any point, no worries, please do so. So let's get into our talk by let me kind of explain why I care so much and I'm so passionate about this topic. I went through my bio and all the things that I do in this space, but what really started off with me, I'd love to share a little bit about the most important person, one of the most important people in my life, which is my brother, Gary. He and I were 8 years difference, but very close as siblings. And you can see he repped Houck from the very beginning with his little Houck shirt. We were as close, really, as siblings can be. And he was amazing. My brother Gary was awesome. He was outgoing and social and generous, creative, business smart. I could go on and on. If you knew him, I'm sure that you loved him. He really was an amazing person. But unfortunately, even though he was so many wonderful qualities in himself, he also was unwell mentally. And in 2005, he died by suicide. So I'll show you some numbers coming up to the scope of the problem, but I want to bring it back to my story and why I care so deeply about this. The problem in the construction industry with mental health and suicide is bigger, much bigger than one person, than one story. But I share so you know why I care so much about this. I do this in honor and in memory of my brother, and I'm just so proud and honored to do this work and to share it with all of you. So let's talk a little bit about what we hope to get out of today, our overall goal today, and what I really hope you walk away believing is true, is that prioritizing worker well-being and mental health, not just traditional safety, can save lives. And today we'll talk more specifically about what mental health is. We'll learn why the construction industry has an issue with suicide specifically, and we'll also hear some ideas on what we've been doing at my family company at Houck and ways for you to learn more or other ideas that you might want to look into. So again, we should have time for Q&A for the folks who are just joining. Feel free to chime in questions along the way, but this is our goal for today. So what is mental health? We'll start with an overview, and some of you may be familiar with this already, but I want to make sure that we're all on the same page. So mental health, when we think of it, it's our emotional, psychological, and social well-being. It impacts our day-to-day. It impacts how we think, how we feel, how we act. It helps determine how we react to situations, how we relate to others, how we handle stress, how we make choices throughout our day. It is a really important part of our overall wellness, but not often as talked about as some other types of health. But there are other types of health. When you think about our overall wellness, there's physical health, financial health, social health. All of those kind of go together to keep someone healthy and well. And when we think about our mental health, it can be related and connected to those other types. So there are studies that show if you're financially stressed, you have a lot of financial burden, that can impact your mental health. Your mental health can impact your physical health. Your physical health can impact your mental health. It's all kind of related. But when you think about, going to the doctor for a broken arm, you have no problem telling someone else that you went to the doctor for a broken arm, but people don't talk about mental health in the same way that they do with other types of health, specifically physical health. So all of it is related. Mental health is so important for our overall health and wellness. And that's why we're talking about it today, just to open up the conversation even more. Mental health is on a spectrum. So when you think about mental health, we want to be mentally healthy. We want to be mentally well. You want to take care of your mental health, but it is a spectrum. And depending on the stresses of every day, you might kind of go between the spectrum. But on one end, we have, we're taking care of our mental health, we're mentally healthy. On the other end, you may have heard the term issue or condition or illness. So on the other side of the spectrum is when there might be a problem with your mental health. The word issue and condition and illness are often used interchangeably, but they do mean like slightly different things. But all are mainly it's impacting someone's life in a negative way, and there are issues. Issue and condition, you'll hear me use those words, but it's more of a broad general term. So there are issues, but it's not a diagnosed illness. An illness is an actual diagnosed disorder, and it's impacting someone's daily life. So you might hear those words, just know that we all should be caring about our mental health. We want to be mentally healthy and take care of it. There's different ways that people do that. But when you do have concerns of maybe not being mentally healthy, that could turn into issues, a condition. It could turn into a diagnosed illness. So if you're wondering, well, how do I know? What do I watch out for when I think about, mental health issues? Let's chat through a little bit about this. The two most common mental illnesses are depression and anxiety. They can be codependent, they can happen at the same time, I should say. But there are others out there. When you think about depression, it's not just sadness. When you think about anxiety, it's not just excessive worrying. There are a lot of different signs and symptoms that someone could be having a problem with their mental health or potentially a mental illness. So I'll share some different warning signs and symptoms. This is not an exhaustive list. It's different for everyone, but at least it gives you an idea of what are some things to watch out for yourself or for someone else. Feeling excessively sad or very low, avoiding time with friends or social activities, problems concentrating or listening or participating, whether that be in school or at work, sleeping too much, sleeping too little, not enough, changes in your eating habit. Maybe you're eating way more than you used to, or maybe you don't have an appetite at all and you're not eating enough. Also, an overuse of substances. Again, this is not an exhaustive list, and we all may have some of these things. When there's stressful stretches in our life, we may have some of these from time to time. Having an illness is more a severity level, maybe a multitude of these things, and it's something that's impacting your day-to-day life. If you don't remember all of these signs and symptoms to watch out for, the main thing I want you to take away to remember if you're concerned about someone or concerned about yourself with their mental health is look for changes. So did they used to, looking at the friend situation, maybe it was an introvert and they never spent time with friends, and that's their baseline, that's their normal. That's not an issue for them then. But if there was someone who was very energetic and outgoing and, thinking about a construction worker eating lunch with their crew, they always ate together. And now there's a change and they're not eating lunch together, they're off on their own somewhere. That's a change. So more important than what is the exact symptom and sign is what is their baseline and what is their normal, and have they changed from that? So that's the most important takeaway I would take from this is look for changes, and these are some ways that changes could happen. Another warning piece to mental illness can be thoughts of suicide. So I just want to take a moment and before moving on and just connect mental health and suicide briefly. They're not the same. Mental health, mental illness does not equal suicide, but they are connected. So when we think about prioritizing and bringing more awareness around mental health, that can help decrease suicide because they are connected. So I'll show you what I mean with some stats. According to research from the CDC, almost 50%, almost half of people who die by suicide had a diagnosed mental illness. That's a known mental illness. There is some research that shows around 90% who die by suicide had some form of a mental illness. It just might not have been diagnosed. So again, not one-to-one, not 100%, but there is a big connection there. They are very connected. And if you're curious of just, well, how common are mental illnesses and mental issues in general, 1 in 5 adults in the US live with a mental illness, according to NAMI. And there was a study done in 2020. This was in Canada, I believe. They did a study with construction workers specifically, and it said that 80%, around 80% of construction workers had some type of mental issue throughout their life, whether it be moderate to severe. So when you look at these numbers, having a mental illness is common, and the 1 in 5 probably is underreported. And in construction, it potentially is even higher. So it is connected, and the more we spend time focusing on mental health and protecting our mental health, that can hopefully help with suicide specifically. But I want to make it clear that, not everyone who has a mental illness will ever even think of suicide. It's not one-to-one. Suicide is very complex. I could talk for another hour on Dr. Joyner's suicide risk model. I'm not going to do that to you. There's a lot that goes into someone being suicidal, and I don't want you to take away that, having a mental illness means you're going to be. No, but it does mean that you can focus on people's mental health and hopefully make a difference with the issue of suicide in our industry. So let's take a step back and think about safety before we get into some more suicide specific numbers so I can share more with you on the construction industry. So this week, actually today, starts the National Construction Safety Week, the stand down for many construction companies across the country, where they do stand downs related to different safety related topics. And safety is critical. Everyone, I'm sure, on this webinar knows how important safety is, not just for people at organizations, but also for the business to thrive and be financially safe as well. Safety can help with recruitment. It can help with retention, productivity. It keeps people alive, and safety is so important. I'm sure you're all familiar with these fatal four. If you're not, here are what the top fatal four according to OSHA are. I know that fall prevention is a big one. We have some both union and open shop in our organization. We have some roofing pieces to Houck, and preventing falls for roofers is critical. It's so important. So I'm sure you're familiar with these. I did some Googling too to see, what is the number one when you look at this. And when I was doing some Googling, at some point, OSHA, for their fall prevention campaign, came out. This is just a Google shot of what is the number one cause of death in construction. And OSHA had said falls. And again, falls are important. When we think about traditional safety, we need to focus on falls to make sure that people don't fall and they stay healthy and don't get hurt. I'm not dismantling that in any way. I'm not diminishing that. It is important. And traditional safety, the fatal four that you see, we need to focus on that as well. I like to think of myself as just respectfully challenging this thought that these types of deaths and these types of issues are what's killing construction workers, because let me show you the numbers. I'm looking at 2021 data. Some 2022 data is out, but with suicide specifically, it's all provisional. It's not finalized yet. It takes a long time to finalize death data for suicide. So all the data that you're going to see coming up is from 2021 data, unless I specifically call it out. Here is an image of how many people in construction in 2021 died by a fall. There are around 350 people that died from falls. And this is very sad. Again, we don't want people to fall and hurt themselves, let alone die. If you look at the full picture of traditional safety work-related deaths, here's where that lines up with the rest of them. So it's a big portion of it, but it is just part of the picture. This is overall number of construction deaths, safety, work-related injuries, fatalities, I should say, in 2021, and there were just under 1,000 deaths in 2021. In 2022, it was just over 1,000. So it did jump a little bit in 2022. This is a lot of people that shouldn't have died and that we need to continue to focus on to prevent these deaths. But let me show you where suicide comes into play. So in construction, in 2021, there were over 4,000 people who died by suicide in our industry. If I added on opioid overdose deaths, that graph would skyrocket 3 to 4 times because people are dying by opioid overdose even more than they are by suicide. And I'll just let this sit with you for a moment. When I look at this, I don't mean to shock you, but this is not right. This is not right for this many people, for anyone really, right? But for this many people to be dying by suicide, it's not right. And so although I wholeheartedly believe in safety and the traditional safety, we need to make sure that we focus on that as well. And I'm going to just stop share and share one more time because someone mentioned they couldn't see it. I did test it before, so let me share it one more time. And let's see if that's working for everyone. Thanks for saying something. I did check before to see if it was going. Okay, so maybe if someone joined after. All right, so if it's still an issue, please chat in and let me know, but I will keep moving, assuming that you can see the PowerPoint. So here is that image, again, just showing that falls and work-related injuries are just a subset of what suicide deaths are in construction. All right, good, it's working for you, thanks. Here are some additional stats to share with you on construction, just to compare traditional worker-related safety to the issue of suicide, just to show you again the scope of the problem. There are approximately 3 job site fatalities in construction every day and an estimated 10 to 12 among construction workers. Construction has one of the highest suicide rates of all industries, depending on if you look at industry versus occupation. They are, number 1 or number 2 when you look at industries typically, but it is up there and it's, almost 5 times greater than all construction fatalities combined. So this is a big issue in construction, and thinking about how mental health can play into this. If we focus on mental health, that's one piece that can help someone not have those thoughts of suicide or help them cope with it and get the help that they need. Overall, here are just some, briefly overall stats looking at the problem generally in the US. Over 48,000 people died by suicide in the US overall in 2021, and a big portion of those are just working age population. You can see the provisional death data for 2022 that has increased a little bit more as well. And thinking of the national rate and comparing construction workers to that. So the national rate is around 14 deaths per 100,000 workers. Male construction workers is at 56. So it is a much higher rate as you go through. It's not just that people are dying by suicide, though. It's also that they are thinking about suicide. So there are around 12 million people who have seriously thought about suicide. Now, you might be wondering at this point why. That might have been a lot to take in looking at those numbers. Again, I don't mean to shock you, but there is a problem. And so why is this happening? Why are construction workers dying by suicide more than basically every other industry out there? Let's dig into why that's happening. We'll talk through some of these. And if you have anything to add as I go along that you know of that I don't mention, feel free to go ahead and chat that in and share other reasons that you have heard of. I'm not going to share like an exhaustive list, but I do want to give you a sense as to why this is happening. So the first reason as to why the suicide rates are so high in construction just comes down to the nature of who shows up to the job, who shows up to work, the demographics, the population. So looking at the suicide rate around males, Males make up around half of the population, but they're nearly 80% of suicides. And then you think about who's working in construction. It's not all male, but it is a high proportion of males. And looking at just who typically dies by suicide more often, it's white males in a working age population. So it just has to do with the people that are showing up to work. There are females too, and that's actually high in construction when you look at other industries for female. But a big portion of people who die by suicide are males in construction. The last I looked from the BLS data was 97% construction workforce is male. So one big reason why is just the population. Another reason why suicide is more common in construction is just the access to lethal means that there are. And none of this is about gun ownership or gun rights. I'm not saying anything about that. What I'm saying, though, is that when you think about the culture, there is a gun culture, for many construction workers. Not everyone, it's not true for everyone, but there are a lot of gun owners in construction, and just having access to a gun, having access to that lethal means increases your risk for suicide. Again, not true for everyone, but there is, often people who own guns. Also thinking about veterans and how they make up our population. Veterans own guns more commonly than just the general population. And with their mission-oriented mindset, a lot of veterans join the construction industry after they serve. And veterans in and of themselves are just a higher risk factor for suicide based on all the stress and the trauma they potentially had serving as well. So having veterans in the population with the mix of guns and that access to lethal means just increases the chance for suicide for folks when you think of it in that way. I think around 6.5% of the construction industry are veterans, according to data I saw. So it is a big chunk of population. And thinking of guns in general, looking at this chart right here, firearms are the most common method used. And just a quick note, that they're the most lethal. You can't go back. So over 50% of suicide deaths are guns. And so thinking about gun storage, gun safety, educating people on guns, I'm not taking away guns, but educating people on the safety of guns, especially if they're going through a mental health crisis, can really make a difference in saving someone's life. So these are two big reasons, but it's not all of it. So let me chat through just a few more reasons as to why the construction industry does have such high suicide rates. A lot of it does come down just to the nature of the work in the industry. So one is that there are regular work hours and long work hours often, especially when you think about construction workers out in the field. Having those long work hours, and especially if it's not regular for them, that can impact someone's sleep, and sleeping patterns can be impacted. I've seen a brain scan of someone on sleep and not, and it like literally changes your brain if you don't get enough sleep. So that can cause sleep deprivation and mental and physical exhaustion. So that can be part to it. Another big piece to construction is just the dependency on weather. And that's something, out of our control for some trades. If you're working inside a building, that's fine. But if you're up on a roof, you can't necessarily do the same work. So there is that seasonality to it. And layoffs can happen depending on the company and the timing. And that can increase stress, both because of a loss of income. But some people, when they're laid off, then also lose their medical benefits too. It just depends on the company. So that is something that relates to it. Just the physical demands and the physical exhaustion. I mentioned earlier that your physical health can impact your mental health and vice versa. We all know that many trades in the construction industry, it is a very physically demanding job. And so that's something that can weigh on someone, both their mental health and the risk for suicide. It's often a stressful, schedule-driven work. It can be a high-pressure industry where we have to get the job done, and things can come up. They can come up with weather. They can come up with supply chain, with customers. A lot of things can happen, and you're tied to the schedule of making sure that you complete your job great for your customers. There's also just this general risk-taking in the environment itself. Oftentimes, there's time away for people, whether they're on a far away job site or they are working overtime, so they're not with their families on the weekends. There can be lots of reasons as to why that's happening, but that can lead to isolation. And isolation is a key piece to mental illness and to suicide specifically. This one is the one that I kind of want to break down the most. And I'm so thankful for all of you to be here to just talk about it more, because I think the more we talk about it, the more we break down this kind of tough guy mentality that often exists. And this can be good for a lot of reasons, to, make sure that we get the job done and to continue on and power through. And there's benefits to having that, that braveness and that tough guy, macho nature. But one piece to this is just that it allows people to not feel like they can ask for help. If they don't want to, they have to be tough. They don't want to ask for help when they need it. So this is one that just in general in the construction industry, I think is so important to break down. And the more we talk about mental health, the more we make it okay for people to ask for help if they need it. They don't have to be that tough guy. I think toughness and strength is actually asking for help. So I'd love to flip the script on that. There is access to healthcare as a risk as well. So depending on what they have access to, definitely depending on what union you're in, make sure you understand what benefits are available for you from the union as well as your own organization. So hopefully, everyone would have access to healthcare, but being able to actually use it is another thing. So being able to, leave the job site if they have to take a whole day or a half day, depending on where their doctor is, that can be hard for them, both financially, but also they want to make sure that the job gets done. They don't want to let their crew down. So it is something that is part of this if they don't have the right access. And they might not want to get the help that they need because it's more important for them to be at work. And some sub crews don't have insurance either. So access to healthcare is one. Pain management. We talked about how it's a very physically demanding job. Injuries can come up too. And so then it can lead to not just self-medicated pain management, but just you could be prescribed a medication from your doctor for an injury, for pain. And if it's an opioid, there's a good chance that you might get addicted to it. So that can also impact this as well. Different changes in tasks and coworkers, the culture of substance use can be part of this as well. And then just in general, the stigma that exists, just in general in the general population, but again, in construction, I think that's the thing that we can do the most is try to break down some of that. This probably isn't even an exhaustive list. There's a lot in here, a lot of reasons why suicide is an issue in construction. And I know this seems like a lot, and you might be asking, well, like, what can we do about it? Some of these things we might not be able to change as easily. We can't change the weather, right? We can't change the unpredictability of when it rains or not. But some of these things we can look at. So if you're working for a construction company and you're here today listening, think about these reasons and think about what you can do at your organization to try to make a dent in them, to try to make somewhat of a difference in them. You might not be able to tackle all of these. And again, some of these might not change just by the nature of the industry. But I do think we can all critically look at this list and try to think about what we can do, what small thing we can do to make a difference with these. So let's talk a little bit about what you can do, what you as a construction company can do, what you as an individual working at a construction company can do. I hope you take away that there is something that you can do, even if it's small. I hope after this presentation, you go back and talk about it with people at your company, and you pick one or two things that I'll show you to try to make a difference, because even one small thing could potentially be that thing that someone needs to stay here. I'll share what we've been doing at Houck so you can get a sense. I'm kind of scattered throughout here, what we've been working on for at least the past 8 months. And I say that we're not perfect. We have so much work still to do. I'm proud of what we've accomplished and what we've been working on, but we still have so much more to do. But I've been there for around 8 months now. And so some of these things that you see, they don't take a lot of time. You can make a difference right away. And there are so many different free resources out there that can help you on your way to talking about this more at your own company and to making a difference. So it can be done. You can make a difference. And let's talk about some of the things that you can do. So here is a six-step plan. It's not an official plan. There are some I'll share with you from the Workplace Suicide Prevention Committee that has different steps. I know other organizations are working. This is just kind of like my own simplified plan for you that if you want to take it back to your organization and do something with mental health at your construction company, what you can do to do more with mental health. You don't have to do it all right away. Pick one thing step by step. Start small. That's okay. Step one is just to care. So I'm sure many of you are here because you already care about this topic. So I'm just going to check that one off. And assuming that if you didn't care showing up to this, hopefully after learning a little bit more about why it is such an issue in construction specifically, and seeing, that, I hope that you care a little bit more than before you walked in. So I'll check that first step off. Step one is care. Step two is to learn more. So I shared a brief overview of mental health, what it is, what to watch out for. We talked through, why it's an issue specifically in the construction industry. There's so much more out there to learn. So this really is just meant to start the conversation and get us opened up to talking about it. To be able to learn more, I definitely recommend you check out the KCA webinars that John mentioned at the beginning of this. There are 3. One is next week, and it's all about the Construction Wellbeing Initiative, and Sebastian will be hosting that. I'll show you a little bit more about that resource coming up, but recommend checking that out with him to learn more. That's more on what you can do at your company using that tool to make a difference in this space. There's also Naloxone 101 with Chris Lalevee, and that I didn't touch on that much. I just mentioned that opioid overdoses is even more than suicide. That could be a whole, other topic. That's something that Chris will talk more about with Narcan and naloxone. That's something that we're trying to get at Houck, more Narcan, just in case of an emergency. Definitely recommend checking out Chris's presentation on that. And then also living, working, and fixing anxiety and depression from a construction executive, looking at it from that perspective. And I appreciate that thinking of, it's not just people in the field that have these stresses, it can be executives as well. So really thinking everyone in the construction industry, what can we do to help their mental health? So attend those in the remaining May Mental Health Awareness Month initiative with KCA. There's also a whole summit conference that if you're, passionate about this, you want to learn more about what other construction companies are doing. The next date is in February of 2025. I believe it's going to be in Texas, but the Construction Working Mind Summit is a great opportunity to get connected with construction companies across the country that care about this and are doing great work. So if you want to learn more about mental health and just the state of this in construction, I'd recommend sending someone to that conference. And then look at what your resources are. I'll show you some free resources coming up that you can use to learn more and to promote at your organization. But check out with your union. What does your union offer as far as mental health, wellness, benefits? Look at what your current resources are so do you need to improve them? Like for us, we improved our employee assistance program so people get more sessions recently and they get more phone apps that they can use for free. What can you do to improve your resources, but also understand and know what your resources are? So I hope that you take away after this one thing that you can do to learn more, because there is still a lot to learn out there and a lot of resources available. Step 3 is to make a plan and figure out what you want to do from there. So if this is all you have time for and you don't have time to learn more, then try to figure out what you want to do from this at your organization. And the first step is to find your people. You don't have to do this alone. This is something that other safety people could be a part of. Your leadership could be on board with, other employees. At Houck, we have a committee of passionate people together to work on different wellness-related initiatives and events. It doesn't have to be just you. Get people from different departments, different areas. Find your people that care about this and can help you out, and then start from there. Once you find your people, then figure out what you want to have as your plan to incorporate mental health and suicide prevention into your safety program and just other initiatives. I am all for embedding mental health throughout the year, but there are certain times of the year that can be easier to add to and maybe easier digested by your employees as well. The first one is now, which you're all kind of a part of now with KCA's Mental Health Awareness Month initiative. But May is Mental Health Awareness Month. There's also Construction Safety Week as part of it. So if you have time this week, could you do something as part of Construction Safety Week or later in May for Mental Health Awareness Month? There's also in September a week on construction suicide prevention, dedicated just to our industry. They have a lot of great resources. I'm on that planning committee I can share with you coming up, but that's a really good week to get involved as well. And then in October is Mental Illness Awareness Week. So it's kind of scattered throughout the year that you can try to place more information out to people and do something at your company. So I encourage you to take a look at this, make a plan, what can we do in each of these times, or go big and just kind of make it part of your whole culture. But if you want to start small, find out what you can do in these times. The next step then, after you make a plan for when and how you're going to do this, is to start communicating. So it is so important just to normalize talking about mental health, share information about resources. What employee assistance program do you have? What health insurance, national information? The more you talk about it, share resources about it, the more we can decrease the stigma that's there. And you can do this in a lot of different ways. So here are some ways that we've done it at Houck. You probably have other ideas, but put up posters on your poster boards or safety job sites, send out emails, include in newsletters, do hard mailings. It's important to make sure that you're trying to get this information to family members as well, not just the person that works for you. There are hard hat stickers that you can get to put on hard hats to just spread awareness and communicate more, and a lot more. Incorporate it into meetings, make a video about it, do social media posts. We've done that to communicate out to customers as well. You might be able to come up with something unique and different at your organization, but communicating and talking about it and making sure that people know what the resources are, then that is one way to just open up the conversation. Here's an example of how at Houck communication helped us with our employee assistance program, our EAP. This graph shows you usage of what our employee assistance program numbers were each month. So average each month, how many people were reaching out for help with our EAP. And you might be able to guess as to when we started promoting it more. So I started at Houck in September, and it's averaged around 3 up until last month. We had a little dip in the beginning of the year, and then last month we had 7 people who reached out. So it's averaged around 3 people per month reach out for a referral for counseling. And this is just from communicating it more, making sure that people know it's available. So from September to November, that's three months. So in 3 months, by including it in onboarding, emailing about it, putting it in a newsletter, just communicating it really helped people get access to the care that they need. So communicating can really help get people help. Step 5 is to educate. So educate people on mental health like you do for other safety related topics like CPR or first aid or fall prevention or auto safety. Some ideas on how you can do that: toolbox talks, stand downs. You're already doing those. You're already likely familiar with those. You can do them on a range of topics. I'd encourage doing one on lethal means and gun safety. There are free resources out there, and I'll share that coming up, but this is an easy way to incorporate mental health out into the field especially, but just into your safety program. For training, how can you incorporate mental health into training that you already have for regular safety training? There are a lot of different types of trainings that you can look at. Here are some of them. LivingWorks is free. You can get that through CIASP. I believe maybe 5 or so employees can take that. It's an online free education around mental health and suicide prevention. There's mental health first aid. We had a group at Houck get mental health first aid trained, and I know that KCA is going to be offering mental health first aid to their KCA members coming up. They're finalizing a date, so watch out for more information on that, but you could get mental health first aid trained with KCA. There's Talk Save Lives, QPR, and then VitalCog. I really love VitalCog training. It's specific to the construction industry. So it's a 1 to 2 hour suicide prevention specific, construction specific training. So those are all different options to look at. Some of them definitely have costs, but some of them don't. And that's a way that you can educate more people. And then look at lunch and learns. What can you do? It can be more than mental health, but just wellness related. Can you have breakfast or lunch? Can you educate people in kind of more informal ways? Talk about nutrition and the the importance of hydration. Talk about the importance of physical health and different ways that you can be physically healthy and how that impacts your mental health. Getting enough sleep is so critical. Teach people and let people know about that. Financial pieces, that's so important to make sure that people are saving and planning and not having that unnecessary financial stress. Teach them how to budget, teach them about their 401k. Not smoking, being out in nature and the environment. There's so many different things that you could have toolbox talks and lunch and learns on. Social aspects, relating with your family, your friends. It doesn't just have to be mental health, but thinking of the overall wellness of someone and educating them on these topics are only going to improve and make their mental health better. So there's lots of ways that you can educate people. Here are some free resources that you can use to do some of that education and also just communicating out. So again, Sebastian's going to be having a webinar on Monday. I highly suggest you check it out. He'll be going through the construction well-being initiative that Scale Signal has. This is a free website. They partnered with Princeton University, I believe. And when you go there, it has a list of so many different interventions that you can do. It kind of shows you ranging from small to big. It shows you cost and the budget. There are so many different things that you can do at an organization to improve mental health and improve the well-being of construction workers. And what Sebastian and the Construction Well-Being Initiative is trying to do is combine those all into one place. So definitely check this one out. At the end of the webinar, I know that Seth and John will be sending out a recording of this. And so I will include some links in there as well, so you can check some of these free resources out. But Monday at noon, listen to this webinar with Sebastian. Another free resource I'd love to let folks know about is the Construction Suicide Prevention Week. This is the week that I mentioned in September, just for construction workers trying to bring awareness to suicide prevention. It's resources year-round, though. So even though the week is in September, there are so many resources that are free and available for you. There are toolbox talks that you see here available in English and in Spanish. We're working on creating more toolbox talks this year as well. There are different helpful links. There's a speaker source guide. So if you want to bring someone to speak at your organization about this, they have a whole list of different people that are great speakers that you could reach out to. You don't have to be the expert yourself. You can bring someone in. So this is a great resource to check out, as well as the Construction Industry Alliance for Suicide Prevention. Sonia is the executive director for this. I presented with her in the past, and she's wonderful. They have a great board really focused on trying to get resources out to construction companies behind no paywall. They just want to give it out to people to make it easily accessible. So they also have toolbox talks. They have different videos. They have a needs assessment that you can take. And then the training for Living Works is also available there. You can take a pledge with them to make a difference. So I would highly recommend you look at CISP and the resources that they have available too. All right, those were a lot of different free resources. Again, I'll send the links to those with this recording. I just want you to know that there is already information out there that you can use. You don't have to create it yourself. You can start from there to get more information out to your employees and learn more yourself. So the last step in this plan that I created is just to continue to improve, right? You have to continually monitor and evaluate how things are going, how your employees are doing, what the need is, and just evolve as time goes on. So this is not a once and done thing. You need to continue to think about what more you can do or what difference do you need to do in an initiative. So here are some ideas of things that you might want to look into as you evolve and continue. Not an exhaustive list again. Think about leadership training. How can you make sure that managers and leaders at your organization know what to watch out for someone with their mental health and they're on board and supporting this mission? How can you address the opioid use issue in construction? Again, Chris has a webinar in a couple of weeks on naloxone 101. Definitely recommend you check that one out and learn more about the role of Narcan in that. Improve support. Look at your resources. Look at what your union offers, what your organization offers. Continue to improve your resources and support. Think about that big list of all the different reasons as to why suicide is high, and look at that list and try to figure out what can you do to make a difference to decrease the risk factors in those areas. Think about other wellness initiatives that you can do. Also, the Workplace Suicide Prevention Committee is a national committee, and they have 8 guiding principles when you think about suicide prevention in the workplace. It's not construction specific, but it is really helpful to think about how you can create a suicide prevention program at your organization. So I'd recommend you look at those too. So again, not a full list of ideas, but something there you can continue to look on. You want to just continue to evolve and try to make a difference. The last resource I'll share with you, not everyone knows about this, but it did come out a few years ago, probably 2 years ago now in the summer. It's called 988. So if you haven't heard of 988, it's similar to 911, but it's for mental health and suicide prevention. So mental health and suicide crisis. It used to be some long number, 1-800-TALK something, you couldn't remember it, and now they changed it to 988. This is one that Chris and I actually are going to, Chris Lalevee, we're on the Construction Suicide Prevention Week Committee, and we're going to make a toolbox talk about 988 for people to learn more about it. So you can look out for that coming up. This is a national resource where you can call 24/7, you can text, you can chat, and they are trained counselors on the phone ready to help you. And the majority of people who call 988 get the help that they need. Only a small percentage actually have to then go on to 911 or something else. This is a really helpful resource. You can call if you know, for yourself, if you're struggling. You can also call on behalf of someone else. So you can, say, hey, I'm concerned about my coworker. I noticed these signs, but I'm not quite sure what to do. And they can help walk you through it. So 988 is a great resource to know about, promote at your organization, but know about yourself. So chat, call, online, texting, everything. 988 is a great resource to know about. Okay, to recap, mental health is important. It should be talked about and thought about when we think about regular safety. So for this week, Construction Safety Week, also think about mental health. If I haven't convinced you at this point with everything, there are a lot of benefits to prioritizing mental health. So to recap some and to give you some new ones, when you prioritize mental health, it can reduce the risk of physical health issues and injury and also errors on the job. It can lower substance use. It can improve overall job performance. It can save money. There's been research that shows for every $1 spent in promoting mental health, it can lead to a $3 to $5 return in investment. Just the loss of productivity and absenteeism can play into that. And then the most important thing, I think, is that focusing on this can truly save lives. And you can make a difference. So I thank you so much for being here today to learn more about this. I hope that you can take 1 or 2 things away to try to do at your construction company. And I'll end with some Q&A. We have about 7 or so minutes left that if you'd like to put in a question in the chat, I'll be looking at that and I can answer any questions that you have at this point.
Maybe someone needs to break the ice, so I'll go ahead and do that, Karen.
Okay.
In your experience within this industry, when it comes to education, is there a certain area that needs more educating than others, or a certain aspect within mental health within all the different areas that you talked about?
Yeah, that's a good question because there's so many different things you could talk about. So it's like, where do you narrow it down? I think in general, just starting the conversation and also talking about resources. So people know maybe they don't want to talk to someone about their struggles, but if they know, okay, I know what the EAP is, I know 988, I think sharing the resources that are available is a really important one. And then another topic that I think is really important is just talking more about gun safety and knowing when to store your gun and be able to lock it up if you're going through a mental health crisis. I think that could be really beneficial. But there are so many different topics. It's hard to pick just a few. But I think as far as education, focusing on starting the conversation, resources, and gun safety is a good place to start. What other questions do folks have?
Hey, Kara, Senator DeSanto here. How you doing today?
Doing well. Nice to see you.
Same. How I came on late, so I apologize. We're in session, so you may have covered this, but trying to address this topic in the construction toolbox talk setting or whatever. how do you get that going? Because, the guys and some girls are, more and more girls in the industry are, very reluctant to engage on anything, let alone a topic like this.
Yeah, so I think there are definitely some people who won't be as open to it necessarily, but at least at Houck, I can speak from that perspective. We recently just did a toolbox talk on mental health, tying it to the construction safety week. We started it last week a little early for May. We already had a stand down for fall prevention set, and then I created just a small, like 5-minute mental health toolbox talk to add on because they were already there talking about fall prevention and just added in, hey, this is another way to keep you safe. Let's talk about mental health. And I think the main thing that I started with at the beginning that I think is useful for everyone to frame it in a way that hopefully people will be more accepting of it is, hey, if you don't think this impacts you, that's fine. But there's a really good chance that this is going to impact someone in your family or impact someone on your crew. And trying to take the step away from it being like a personal thing, maybe they'd feel kind of weird thinking, oh, I don't have an issue with this, I don't need to talk about it. But framing it in a way of like, this could happen to someone on your crew or this could happen to your child. We want you to be prepared to know about it. And that can maybe help a little bit with the conversation, but I think people just have to start to try it little by little and integrate it in, and tying it to the big months can make it helpful too, I think.
Great. So are you going to email a presentation you went over? Because I didn't see the first half. I can take a look at it then.
Yeah. Seth and John from KCA they recorded the whole webinar, so they'll be giving that out to the attendees. And then I'll also be listing some of the links that I shared about free resources as well. And then my email too, just for everyone to know, if you'd like to email me personally with other questions outside of this, you can. It's kmccaffrey@houcks.com, but you will be getting the webinar recording.
All right, you need safety glasses on your little emoji.
Yeah, I do.
All right, well, thanks so much. I enjoyed the part that I did see. So
thank you.
yeah.
To his note, I did really like, I haven't heard this before earlier in your presentation, how construction workers tend to be stoic and brave, and they don't want to talk about stuff. But I loved how you switched the table and said, look, it's tougher to get help than not to get help. And that's totally true.
Yeah, I love looking at it that way. Like it's strength to open up and say, oh, you know what? I do need help. Like let's flip, change the script of like, it's actually strength and bravery to get help. And yeah, thanks, Seth. Any other questions?
Who else? Who else has a question? We have a comment in the chat here from Scott Berkey. I just want to echo his comment about he's glad to hear about Houck's focus on EAP, that's increased the employees' engagement. And within the Carpenters Union, this was probably 3-4 years ago, we were looking into the EAP and promoting that. And I was personally blown away, like how many workers didn't actually know about it or know the number, how to get in touch with someone if they needed help. So it's definitely a thing that employers need to do a better job of.
I've heard of that says you need to tell someone 7 times before they actually remember it, and like in different ways, so it's not just telling someone once about it. You need to tell them multiple times because people might not know all the resources that are available.
Yep.
Okay, well, to end, I just want to say thank you to everyone, and especially thank you to KCA for hosting this and continuing to prioritize this topic, not just in May, but year round. It's so great to partner with you, John and Seth. Thank you to KCA, and I hope that everyone's taken away from at least 1 or 2 things that you can try at your organization. So thank you so much.
And then thank you, Kara. I know I jotted down a ton of notes, so I have a lot of takeaways, and always enjoy talking with you about this topic and the subject, and you do an amazing job. And I'm sure on behalf of all the attendees today, I'm sure they agree with me saying thank you so much for spending some time and educating us and starting the conversation, keeping the conversation going. So thank you.
Thank you.
Thanks a lot. Dropping off here. Thank you.
Thank you. Thanks, everyone.